Welcome to the Dentist Show. Let's jump right in.
Well, welcome to the Dentist Show.
The Dentist Show.
We are back.
Yeah, back to you.
This time we are in the lovely state of Washington, city of Spokane Valley.
Yeah, Spokampton, as some people call it.
Oh, it's beautiful here. When I landed today, there was snow on it. At least by the airport. I don't see some.
It was actually probably by when you landed, there was like little snowdrop or snow particles coming out of the air. Yeah, like I think they call them snowflakes.
Man, I landed and I looked out. I was like, wait, why did I come here? I'm already cold just sitting in my seat. Looking outside, it's all kind of foggy coming down and cold.
Yeah. We call that gray.
It definitely reminds me of Ohio. This is how Ohio was for like 6 months out of the year.
Yeah.
Hence Raquel hated it.
Yeah, Spokane has, in my opinion, some of the highest highs as far as like some of the most beautiful times of the year. And then there's this. It's just gray and there's snowflakes coming in the air. It's cold enough to make snow, yet it's not white outside. It's gray.
Because snow would look nice.
Yeah.
And it's just dirty.
Yeah.
At least that's Ohio and Utah would get it.
Yeah.
When it wasn't snow on the ground, it was dirty because all the ice melts and the salt. So, but it's here. We are here. Yeah. We're in Spokane. We're actually at our Spokane Family Dental Office.
We are
in Spokane Valley, Washington.
Yes,
99022.
99206.
What was 99022?
That is medical aid. Also in Washington.
99026.
206.
206. Wait, that's too many.
99206.
What was I think my Mesa, one of the Mesa offices, 85206. So.
Actually, I think that is Mesa's, yeah.
Yeah, so hey, we're in the 99206 zip code representing
the 509 area code.
509. And I'm in my sweatshirt, although after setting up all his equipment, I'm a little sweaty now.
Yeah.
But I had to bring my son's sweatshirt because all mine are too thin. And I was a little worried how cold it was going to be. And here I'm sweating.
Oh, it's so funny. I remember when I first moved down to Arizona, I was pulling in after leaving snow, like snow falling on the ground. The neighborhood kids were sliding down our like loading deck or the loading ramp into the moving truck. I pull into Arizona, jump out of the moving truck in shorts and a t-shirt. Yeah. And I'm like, this place is awesome. And everyone around me looks at me like I'm crazy, and they're wearing like full-on coats.
That's about right. A week in Arizona.
Yeah.
When we first moved there from Ohio, we were like, man, people are wearing sweatshirts and hoodies and stuff in October, and it's 80 degrees outside. And now we're one of them.
Yeah, it's one of those things. Your blood thins out.
For sure,
as they say.
It does. Whatever it does, it makes you a wuss. Because when I go back to Ohio, Utah, Washington, I'm always all geared up. Although I have put on weight, so I'm a little warmer than I was a few years ago.
Yeah, I think we mentioned that in one of our podcasts that as you watch us progress, hopefully you'll see our faces get thinner instead of fatter.
We can't see it, but we put a table in front of us so you can't see our guts.
Yeah, we were a little self-conscious of our YouTube presence.
Yeah, so we made it better so you can see our fat faces.
That's right.
And our fat stomachs.
But
you will see some weight loss occurring.
Yeah.
In maybe 4 or 5 months. Six months. By 2027, we'll see some weight loss. So.
Yeah, that's just called old age because you're starting to dwindle away.
Yeah, it's very true. Well, on this episode,
I was gonna say what brings us together today.
Yeah, so what brings me to Washington too, is to talk about our goals for 2026 and how we've evolved setting goals.
Yeah,
and they're so important to me and to Ryan. And how I used to do them for like our offices was I would just pick a number. So the first few years it was just random goals.
Yeah.
And then like in 2013, for example, we grew by 58%. In 2014, we grew by like 42%. And then it kind of slowed down to 20%. And so then when I started having multiple offices, I'm like, our goal is to grow by 20% year over year.
Yeah.
And that was it. So the team would meet in January, would say, hey, 20% goal. With last year we did 2 million. This year this year we're doing 2.4 million.
Right.
And that was it. And then
Simple math. That makes sense.
Simple math. Then we did 2.4 million. Hey, this year we're doing, now the math's getting harder, almost 3 million.
Yeah, I was gonna say 3 million.
2.9-ish. And that was my philosophy. Like, I want to grow 20% year over year. And that was how I set my goals.
Yeah.
And to the team's credit that was with me and are currently with me now, they were like, okay, let's do it.
Yeah.
Like, no questions asked. Let's go after it.
Oh.
And now when we have bigger offices, it's a little harder, one, to go 20% year over year.
Yeah, when you do 20% of, a 4 million a year revenue practice, it starts to
throw on $800,000.
Yeah.
Yeah, it gets tough. Our $5 million offices, you just throw in $1 million.
Yeah.
And you can do it, and we do it, and it's just got to be more intentional. So I wanted to break down how I look at goals now, a little different than 20%, and 20% is still doable.
Yeah.
And you just got to be intentional with how you present that to your team.
Yeah.
So it's not, well, what do you mean we're going 20%? We can't even handle what we're doing now. And you're going to throw in another $800,000 just because your words came out of your mouth that you want to do 20% more. Like, congratulations, Ryan. It's not going to happen.
But I want it to happen.
I want to make more money.
Yeah.
So
I want everyone to make more money.
Yeah. Well, everybody make more money. So just make it happen.
Yeah.
And the process we've created might help not just the dentist owners, but we kind of found out we have a lot of non-dentist owners that listen. So this would be a similar technique, although you wouldn't use your dentist associates or your production or your hygienist production, but there would be other team members that you have in businesses that you can do the same thing. You break it down to see if even on paper are you able to hit that goal, or what you'd have to change to hit the goal that you'd like to meet.
Yeah, and like what are parameters that you think of when you're like, what can we change, or what do we want to change in dentistry that could maybe be used in other businesses? I think of new customers.
Yeah. So if you have a new patient count, and you need to increase it, you need to decrease it, you need a different market, bring in more dollars per new patient, or is it just an increase of your case acceptance that we call dentistry, or I don't know what your
probably acceptance rate of your sales rate, close rate
non-dentist. And so let's dive into it. So we won't name the offices nor providers.
Yeah.
But we have one of our practices, the 8 right now, that we want to discuss. And so in the last 12 months in business, they call it TTM, or trailing 12 months.
Yep.
This office is done. We'll just average it out. So it'd be 4 million. This is slightly under, but 4 million year over year, or the last 12 months. So we're in December now. So December of 2023 through November 2024.
Right.
This office did $4 million. How many dentists are there, or how many doctor days would you say there are?
Yeah, doctor days a week. So you can use this calculation in all of your practices. So your doctor day is how many doctors per day multiplied by how many days they're in the office. So we've got one doctor that's here 3 days a week. So that's 3 doctor days. We've got another doctor here that's 3 days a week, 3 more doctor days. We've got a doctor that's here 4 days a week. So that's 4 doctor days. And then we've got another doctor here that's 3 days a week. So in this office that we're talking about in particular, we're looking at, 9, 10, 11, 12, 13 doctor days.
13 doctor days.
Yeah.
Okay, how about hygiene days?
Hygiene days, we average Monday through Thursday, 4 hygienists a day, with 1 on Fridays.
So 7.
Yep.
Okay, so let's break that down as far as your dentists go. We can get pretty granular into this too, but let's keep it relatively generic.
Yeah. Right.
So this office, in this office A, let's call it, is very doctor driven. The production is. So let's say 80% of that 4 million comes from doctor production and collection.
Yeah. So we're looking at, what is that?
3.2 million.
Yeah, I was gonna say three something.
So 3.2 million is by the doctors, and then 800,000 by hygienists.
Yep. Then 800 by hygienists.
Okay, and so that's divided by 13 doctor days a week, which is like 52 doctor days a month.
I might have to bust out the Rubik's, or not Rubik's Cube. That's,
Well, let's make it easier on us. You have an equivalent of like 3 full-time doctors.
Yeah.
Right, more or less 3 a day.
Yeah.
So if you do 3.2 million divided by 12. Oh yeah, we gotta get a calculator. Sorry.
yeah, here it's okay.
My math's going wrong now.
Yeah.
I'm not a good estimator anymore.
You know, while you're doing that, because it's fun to point out, remember when we were kids in school and our teachers, our math teachers would say, why do we got to learn how to do the times tables? Like, because you're not going to walk around with a calculator in your hand. Boy, were they wrong.
That's why I try to tell my kids, and we might have had a conversation about this before, is the power of being a good estimator.
Yeah.
And so if you can get close, it'd be so much power in that, where you can go that within a couple percent or within 10%, and it's such a good skill to have.
Yeah, actually, I've noticed that about you. You're actually really good at it.
Yeah, good.
You're just like, yeah, I'm close enough.
Close enough.
Yeah.
Within 10%, I'm pretty good.
See, I'm more like I can jump that kind of guy.
I can do that. Okay. So if you divide that 3.2 million production by your doctors, that's 266,000 a month in doctor production, which would mean each doctor is producing about 88,000 a month. So this is probably about right. You have a heavier producer, a medial, and a lower.
Yeah, that sounds about right.
More or less. And you actually have, there's actually 4 doctors in this office, but some are part-time. And
to make a more full-time.
Being 3. Okay. And then your hygienist, you have pretty much 4 hygienists. So that's 16,000 a hygienist per month. That's actually a little under. That's why they only do 20%. Because you're typically, at least in our 8 offices, our goal for our hygienist is typically 20,000 a month per full-time hygienist.
Per hygienist, right? And we don't have, in this particular office, we have a range of part-time and full-time, right? And I think we've talked in the past that when we look at a full-time hygienist, we see that they tend to be a little more productive per day when they're here more days.
Yeah, they just have more of a patient following.
Yeah.
And they get the trust of the patient. All right, so that breaks it down to where all the production comes from, because is the front office producing anything?
They are not.
They are
helping.
Yeah, they definitely help. I mean, we wouldn't be anywhere without our front team, but they're not production, so you don't have to really count them into this. Although it will play in a role where becomes a bottleneck or a capacity issue.
Right.
Okay, so next year's goal, if we did 4 this year, next year what are we going to do? 5.6.
Exactly. 20%.
We're going to do 6. No, that's more. That's
25%.
40%.
Oh, 40%.
1.6
No,
million
20,
growth.
Yeah, I guess 20% would be what?
4.8.
Yeah, I'd say 7 something. So
Some. He's from Cheney.
I'm not from Cheney. I do. Cheney's great. I went to undergrad in Cheney.
Yeah,
that's where I learned how to do my math.
Eastern Washington. They let anyone in.
Like I said, I'm not good at estimating like you are. And
so what should be like so say we did 4 million this year. We did 4 million this group in this practice A. What would be our goal for 2025 in this practice?
Yeah, we kind of talked about that. Like I was like, well, if we go with our normal 20%, starts to get up there, big numbers, and then how demotivating can that be to our team? Mm-hmm. And then is it reachable at that point?
Yeah.
So one thing that you and I have talked about is, if we're going to start setting goals for these practices that are getting bigger, maybe we shoot for a 10% growth, and we can't just say, let's do 10% the way we are. Plan for 10% in the sense that how many new patients do we need? What does each doctor need to do? Do we need to add a doctor? Right? And do we need an extra hygienist? Do we need more
Okay,
hygiene
so
days?
what's your you went way down there. So what's the goal in this practice A?
In this
for
practice
next
A?
year? We'll get there, Ryan. We'll get there.
I'm so sorry. Let's do, I like 10% for practice A.
So
I think-
4.4 million.
Yeah, I think 4.4 million is achievable and allows us to not only grow, it'll also allow us to systemize and get better at what we're doing.
Okay, so you go to your team and say, I want 10% growth. Let's make it happen.
Yeah.
And you might get some kickback from time to time. But so let's break it down like you started mentioning. So does that equal, so that's $100,000, it's $400,000 spread over 12 months. So it's $33,000 extra dollars a month.
Right.
So where does that come from, Ryan?
Yeah. I think to grow, Office A by that 33,000 a month, I think we have the capacity with the existing doctors. I think we have the capacity with our existing amount of hygiene days, right? We just did the math. That's 16,000 per day, and we're hoping to get 20,000 per day. So that's 4,000, per month per hygienist. So that's 4,000 per hygienist per month. And so where does it come from? I think it comes from optimizing our treatment plan acceptance rate with our existing.
Let's just backtrack 1 second. So You're right. So if you get your hygienists in this practice A to do 20,000, your full-time hygienist average 20,000 a month.
Right.
That would increase your production to about 16,000 a month.
Correct.
So that's half, because you only need to get 33,000 extra a month. So if each hygienist did more, and not just make them do more work, but
Right.
there's a way we can talk through that. But if you can get them to do the average, the national average is all we're asking for, is about $20,000 a month per full-time hygienist. That gets you halfway there. And then if the rest goes on the doctors, how much do you think that is extra a month per doctor?
Well, we're talking about how many doctor days we have?
4 doctors, full-time doctors.
Yeah. So let's just say
17,000.
20,000 for easy math,
Okay.
right? That's 5,000 per doctor.
It's not, per month.
Per month.
That's
yes.
not that much.
No, that's like an Invisalign case.
yeah. Invisalign case. Yeah, a bridge.
A bridge. Yeah. A bridge and an couple extractions here.
Yeah, it's not much.
Boom, you hit it.
Yeah, when I was just doing the math,
Maybe we need to go up by more than 10% at this point.
4,200 per doctor.
Yeah,
is all you need. If the hygienist if we were able to get them more productive.
Yeah.
So let's break down the hygienist, because most hygienists, I assume, just don't want us to hear us say, we just want you to do more, work more,
right.
busier.
How can we make it more profitable and more productive with what they're already, without adding as minimal possible to what they're already doing, right?
Okay. One thing that we'll discuss too is next year we are going to start charging credit card transaction fees, because it seems like everybody's charging me and us, the companies, and me personally,
Right.
even the government. I went and paid like a water bill, and they charged it.
I know, isn't that wild?
Jeez. So we're going to start, and we're going to charge 2.49%. So that helps like a tiny bit. 0.5% bump is all you get over the whole year.
And it offsets some of those costs.
Offsets some. So you have like a little bit there.
Yep.
But what other ways? We'll dive into some like our hygiene training another visit. But what are some like top things in your mind that a hygienist could do to maybe increase their production without seeing more patients?
Sealants.
But yeah, adult sealants, kid sealants.
Kid sealants, adult sealants, increasing that rate.
Yeah.
Fluoride.
Fluoride. Yeah. Our hygienists typically get credit for taking whitening tray impressions and stuff that happens in their chair.
Right.
We give them that production. But they can also do one thing in our office is I think a lot of hygienists do is they do scaling root planing on 1 to 3 teeth all the time, and we don't code out or charge for it.
Okay.
So more intentional with what we're doing, what we're getting paid for, what our liability is.
Yeah, make sure that the treatments are actually matching what's being done.
Yeah, I don't think it takes much, because if you're not, the hygienist doesn't have to do too much each day to to make that difference up.
Yeah, what is that? We're talking $4,000
Hygienist.
per hygienist a month. If the average hygienist works,
This is based on 20 days.
based on 20 days. Yeah.
Yeah. So like $200 a day.
Yeah.
It's not much.
Not much.
Yeah, and we found success. There's a new product. We use Arrestin. For those that don't know what Arrestin is, it's an antibiotic that goes underneath the gums for people that have gum disease.
Yep.
And there's a new product, and it's quite expensive. And the research on it is just kind of sketchy. It's good and bad. I mean, it doesn't work and works. Depends on what you read.
Yeah.
And there's a new product called Hibanex, and that is less money for the patient. So your case acceptance might be a little higher on that one. You can try out.
Yeah.
So I guess a few things the hygienist can align and not do any more work, because a lot of us can be assistant driven.
Yeah, and doing something like that, selling more toothbrushes in the office.
Yeah. Yeah, it's not much to get $200.
Water
actually.
pick, like,
Yeah.
I mean, you sell a water pick and a toothbrush a day, boom, you hit that 200.
Yeah, no, costs too much to. It doesn't take too much to get there. And for the doctors, we've already discussed, because most doctors actually do just want more new patients. That's all. That's always the go-to problem for our associates is I want more new patients.
Yeah.
But besides that, what else can our doctors do to be more productive?
Same day treatments.
Yeah.
Be willing.
Treatment. Yeah. I think we talked about that. I think most our doctors are on board with that too. They really get how much that helps our patients.
Yeah.
Of not coming back 3 or 4 times. They can get it all done in one visit.
Yeah. I think that's, we've talked about it in the past. Like, that's how we really do focus on the patient. It's like to add 15, 20 minutes to our day can really help a patient.
Yeah. That'd be, huge, the same day treatment. And then also if they are in the chair, to try to do a little more while they're there versus having more appointments.
Yeah. If we already got them numb on the lower left and they have a filling on the lower left while we're doing the crown, let's do the crown and the filling.
Yeah.
Right.
Yeah. Doesn't take much. I mean, if you're talking, a lot of our doctors average, 5,000 to 7,000 a day in production.
Right.
And so to add 4,000 extra a month is not much at all. And I think most doctors that aren't really at capacity would really like to do $4,000 more a month. That's right.
That's very, very doable. I don't think there's any doctor in our team that's would say I'm too busy to add $4,000 to $5,000 worth of treatment.
Right. Exactly.
I think anyone would be like, oh yeah, we can totally do that.
Yeah. Doesn't take much. It really doesn't take too much at all. So that's our, so that when you break it down like that for the team, a 10% increase isn't that hard at all and very doable. And
Yeah.
I think and if you want to break it down even more, you could get more into the new patients. So say like the schedule of our hygienists are only 70% full. So 7 of the 10 hours, or whatever.
Yeah.
You want to do or 3 of the 10, every 10 hours is empty.
Yeah.
And so if we can get a little more, we can see more patients or patients show up.
Yeah. Even if we got it to 8 out of 10. Right.
That would do it.
Yeah.
We'll almost do it. It'd be really close because your average hour is about $125 in this practice AA.
Yeah. So you do 8 out of 10 hours and a toothbrush.
Yeah. Or fluoride.
Yeah.
Or FMX or something.
I think what we're probably the point we're trying to make is if we roll out a goal of 10%, that can seem daunting.
Yeah.
We break it down to like, this is how we get 10% more. And
Yeah.
this is what 10% more really means.
Yeah.
And break it down to the production side. Then I think it really makes it palatable to the team. And I think they're more likely to want to do it now that they know, all we got to do is get 1 to 2 patients more per hygienist
per month.
And
Right.
bam, we meet our goal.
Yeah, it's not that difficult. And if you also think at it, when all your fixed expenses are paid, either way, if you hit your goal, you know hit the goal. If you can increase your business by 10% in a year, a lot of that is to your bottom line that goes to your pocket.
Right.
or it goes back to the team that is making it happen, you can give them raises or bigger raises because that is happening.
Yeah. Do
So
some
it's-
experiences with the team, stuff that we've talked about before.
Yeah, I think it's so impactful for them, and it's not that much more work. So I say we go by 30% in this practice A.
Yeah.
Let's go to 5.2 million
5.2.
next year. Come on.
I
Catch
think
the
we can
big
do it.
guy.
Let's
Catch
do
one
it.
of the big practices.
Yeah.
You can do it.
Let's do it.
You can do a team. Just kidding. We'll do 4.4 in this practice that we're discussing, and I think it'll be very easily achievable.
Yeah. And I would like to say this is like, as we achieve that goal and we continue to achieve it, then we can always reevaluate.
Yeah. Like, and sometimes I've had goals or a year where I did set that 20%, and then we're like not even close. Like, actually, one of the offices, I think one of my team leads came up and said, "So we only have to do $550,000 in 6 weeks, and we got it." And well, I mean, our goal is like 417 a month, so it wasn't like that.
Yeah, it
outlandish.
wasn't that.
But when she said it, I was like, "Yeah, we're in close."
Yeah, I think we were talking about one of our other offices. They're like, yeah, all we need is 600 and something by the end of the year.
Yeah.
And it's December 2nd.
Kind of $600,000.
Only almost double our goal.
Yeah, you can do it. Yeah, actually, most of our, I don't know about most dentists out there, most businesses, but it seems like dentists were been done a little down this year.
Yeah.
And we had in 7 offices before this 8th one, and actually I know for a fact the 8th one, we didn't own it, but they had an awful summer too.
Yeah.
So it seems like the summertime was quite low this year.
Yeah, it was definitely softer than anticipated based on previous years. Like,
Yeah.
especially in the Northwest, we dipped down the most in our summer. That's when everyone's out playing. That's when people are calling in like, I don't want to go to the dentist. Yeah.
Excuses, right?
No, I'm not saying.
Come on,
I'm
get
not
that
saying,
mindset right,
Hey,
Brian.
whoa! We've talked about this. Like,
Doesn't happen here.
September is created by thinking September exists,
Yes,
right?
It doesn't happen.
Yeah.
People want to get out to the dental office.
They want to leave work to go to the dentist.
That's right.
When it's 80 degrees outside.
Yes, they do. I would. But it's I don't know where we're going there, but you can do it.
Yeah. Yeah, I think basically the short end of this episode is...
I remember now.
Okay.
Because everyone had a crappy summer.
Yeah.
I was getting to the point that I don't think most dentists probably hit their production goals that they set last year. And none of our offices, none of our offices hit goal. One practice that actually got pretty close, one tanked. One is doing way better now. A couple are like average. All the practices grew.
Yeah.
And it just didn't hit quite the numbers we're hoping for or what we preset. So if you're in the middle of the year and you're just slaughtering it, you don't feel bad. You got to increase your goal as long as the team gets compensated accordingly.
Yeah.
Or if it's the other
opposite.
way, tell the team they're all getting paid less.
Yeah, see how that fares for the team.
They'll love that. But you can also readjust it so then it doesn't become like this goal they can't reach.
Yeah.
It becomes so far out of the way.
Well, that's kind of what stimulated this conversation, I think, a little bit was, we were talking about setting goals for next year, and we don't want to deflate our team's desire to make goals and to grow and to develop. And if we make this outlandish goal, and you can make outlandish goals if you have a plan.
Yeah.
We just don't want to make outlandish goals without a plan.
Yeah. And say you did want to grow by 20%, then say like, okay, I need to bring a specialist in the office, or we're so busy we need to bring another provider. That opens up a whole new realm of 20% is easy, and that's when taking an office from 1.5 to 2 million, which is more than 20%, is totally doable because you're bringing in providers, you're bringing that capacity, or you have the capacity to grow that much.
Yeah, you got the space, the capacity. You bring in a new provider, bam, it's there.
Yeah, if you already have your marketing down, it's quite easy. So that's how one way you can break down your goals to make it easier for your team. And I have found that's the team's more receptive and they understand like, oh, that's not that much. I can do that. We can do that. And if you can increase their pay, we're trying to get away from bonuses as much as possible and just have the best or highly paid team in the area.
Right.
I think that goes a lot further too, and then we can tie their pay to the goals, and make sure we hold them accountable to get there. They're getting paid for it.
It's a kind of set that agreement like, hey, we're paying you for reaching this new goal. We've established how we're going to reach this new goal.
Yeah.
let's go do it together as a team.
Let's do it. Let's make it happen. So that's 2024 is almost a wrap.
That's right. So get out there.
And vote. Oh, wait. No.
Already happened.
Okay.
We're well past that.
Don't vote. Well, in California, there's one House seat that's still being
Undecided
counted.
or still being counted?
Yes.
That sounds like fake news out there.
Yeah.
Like, what was that movie called? It's about a candidate that they keep counting votes, and there's like a few $100,000 vote or a few 100,000 votes out there that don't exist. Like they're deceased people and stuff.
Fake. Oh, that sounds like 4 years ago.
Yeah,
I heard all about that. Oh,
anyway.
Hey, and then there's an episode I'm going to come back to. There's a TikTok dance we kept talking about.
Oh, yeah. What's his name?
Brady Smith.
Yes.
Dr. Brady on TikTok.
Yeah. Hey, Dr.
Pretty
Brady,
funny
if
guy.
you're
He's
listening
not
to us.
Nah, he's stupid.
Dr. Brady, if you are listening to us, we would love to hear from you.
Let's wrap.
Thank you for listening to another podcast of The Dentist Show. Leave your comments, rate us, follow us, do all the things you think we want you to do.
Or don't.
We'll
be here next week. So if you like us or not, just keep listening.
Awesome. Thank you, guys.
Okay, until next
and
time.
gals.
Thanks, guys.
Thanks for listening to The Dentist Show. We hope that this episode helped you make smiles about more than teeth. To get more resources to grow as a dentist and to learn more about Chase and Ryan, go to thedentistshow.com or just follow the link in the show notes. If you enjoyed this episode, share with another dentist in your life and help us grow the movement. And be sure to rate and review wherever you're listening.